Welcome, everyone. We're going to give everyone a few seconds to come in from the waiting room, and then we'll begin. Welcome, everyone, to the NAAIA webinar, part of our three-part series, Employee Benefits in our Industry Impact Series. We want to give you a few housekeeping remarks to help you enjoy this webinar, and then I will turn it over to the panel. As you all are aware, in the webinar format, when you join, your camera and your microphone are muted. However, you can still interact with us using the chat feature, where you can answer any and respond to anything asked by the presenters. We do ask if you have any questions that you put those specifically in the Q&A box, and so that those are answered by the panel at the appropriate time during the session, as well as during the Q&A session at the end. If you want to change how your picture looks, you can hit the buttons above the video screens to change the view on your end. And if you have any challenges or questions, feel free to send a chat to all panelists and we will address them as we're able. Again, please put your questions in the Q&A section and enjoy the webinar.
Okay. So, Jeff, I just want to make sure testing. All right, so I think you all as well. And good afternoon, everyone. My name is Quincy Branch, and I have the pleasure of being an introduction for our today's session. Again, I am a previous past chair of NAAIA National, and also I have an agency that specializes in employee benefits. So today's session is really important, and I'm looking forward and eager to hearing what the panelists and the experts have to say when we talk about how COVID-19 is affecting our industry. And over this week, NAAIA has done some really good and impactful discussions about how COVID-19 specifically is addressing and impacting and affecting our industries. And so today's session talking about employee benefits will be no different. And I'm looking forward to it again, as I mentioned earlier, and really excited about it. We are having our panelists that are being moderated by Susan Roop, who is the managing editor of Insurance Newsnet. And so with that, I'm going to turn it over to Susan and let her introduce you to the panel and get this wonderful session started.
All right, thank you, Quincy, and thank you everyone for joining us. With us today, we have Daniel Tropiano from United Healthcare. We have Steve Kelly from ELAP Services. And we have Al Schubert, who is with VSP. So employee benefits have always been an important tool to attract, recruit, and retain workers. But in the COVID era, we're seeing a new importance attached to those benefits. We're seeing how crucial they are to the well-being not only of the employee, but also to their family. So our panelists are going to give us some great insights as to what they're seeing now and where they see things going in the future. So we're going to start with what's happening now. And we want to ask, what is top of mind in your business right now as we're dealing not only with COVID-19, but also with racial inequity? And I'd like to start with you, Dan, and give us some insights as to what you're seeing happening at United Healthcare.
Hi, first, thank you for having me today. It's a pleasure to be able to speak to this group and looking forward to an exciting discussion. Right now, specific to COVID, it's the paying for the COVID claims, and it's also looking into the future, into 2021, to understand what this may look like as we go into next year. Currently, as far as costs go, the administration of COVID care has really not been a burdensome cost. Where the costs are really being incurred and where we expect them to be incurred significantly going into next year is around testing and hopefully the vaccine in the second half of the year. So we've actually seen significant claims abatement in 2020 due to folks not going for non-emergent care because we were shut down for a while, and now they're just not coming back at the rate that they were during normal times, even though it's come back significantly. We expect that to continue slightly into next year, but we do expect costs to increase, again, as a result of testing and of the vaccine. You know, for example, we expect the average person to get 5 tests. I have a son at college, and he's getting 1 every week right now. And then also vaccines being administered to the larger population over time will be part of that cost as well. So again, our focus right now is how do we take care of those folks who may be getting COVID and need treatment for that, and then trying to look into the future to see what's going to drive those costs as we go through 2021.
Okay, and Steve, let's turn to you. What's top of mind right now at ELAP Services?
So thank you, Susan, and pleasure to be here, by the way. I am also an employer, of course, and we provide services to about 550 individual self-funded plans across the country. So we perform a service called reference-based pricing. We also own an affiliated third-party administration service. So we are really at the hub of a lot of self-funded plans. And these are typically groups 400 to 2,000 employees. That's kind of our sweet spot. And I'm one of those employers myself. So what's top of mind for me is some of what Dan just said. For our business to be successful, we rely on employers to have a plan in force and for workers to be going and receiving medical services. And the first part of that, we have not been impacted terribly by unemployment, although unemployment has significantly spiked nationally. We have maybe just perhaps lucky, or perhaps the stimulus is keeping some of that down, but it has not impacted our business terribly. We have seen a significant decrease during certain months in elective procedures, which affects our bottom line. But that has, similar to Dan's experience, that has ticked back up. We're probably running about 9% below our anticipated revenue for the year, but it's been a bit of a roller coaster ride. And we're wondering from a cost perspective for our clients, how much pent-up demand is in there? Are there a lot of people next year that will be, when they feel more comfortable, and if and when we return to some form of normalcy, will they just go rushing out for procedures, elective procedures perhaps, that they've held back on? So, you know, that the business overall, we are very fortunate. We have not laid anybody off, which was a real, something we really are striving to do. We've made some significant cost-cutting measures just to be conservative and prudent, but we've been able to hold off on any kind of layoffs, and we've actually seen some pretty significant growth. We're at 9% off of our target, but we had some pretty ambitious targets so far. Well, you have to, I think everybody has to look at the fourth quarter with a bit of apprehension. We just don't know what we're going into right now. And certainly, there could be a significant uptick in COVID infections and spread as we go into the fourth quarter. You know, as an employer, I really can feel that a lot of our folks are stressed. We're all reaching a bit of a fatigue level, I think, and the back to school has hit a lot of people pretty hard as they try to arrange the logistics. We probably have a lot of two salary families that might be down to 1 now within our workforce. So there's just a lot of stress. There's a lot of uncertainty, and you can feel it. So we're trying as an employer to look at what can we do to help people, to sustain people, to offer any additional services we could. In turn, we're doing support groups, for example, parent support groups regionally. We have offices in Salt Lake City, Dallas, Fort Worth, and Philadelphia. So we're trying to have people regionally speak what is the situation there? Are there learning pods? Is there daycare? Are there different support systems that they can access? So we're trying to do that. I also find as we speak to our clients, there's a need and perhaps a product even, a service that would help people coordinate all the other services that are out there, because it can be just overwhelming to be able to provide testing for your people when they need it, to provide daycare. And we've had people with all sorts of situations, that are actually significantly impacted financially because someone lost a job in their household. So it is it's a time of stress. It's a time of, I think, a kind of a reassessment of what's important to our workforce and how do we support these people that have made us successful. But we are fortunate as a company that we are doing pretty well and our workforce has remained intact. So that gives us a good basis to look at these other problems that are occurring. And to also, I think, we're soul searching a bit. What is our role in the community? Who are we as an employer? What is our obligation to others? There's the COVID issue, then there's the corresponding social discussion that's going on, and we're trying to kind of find our place in these two realms. And with all the uncertainty, it's not always easy, but I feel blessed that we have been able to keep on keeping on, just keep on a straight line, and so far so good, although not easy.
Mhm. Okay, thank you, Steve. Al, your business is a little different. You deal in voluntary benefits. And so I'm wondering what's top of mind in that world?
Thanks, Susan, and thanks to the association for the invitation. Many of you know BSP Vision Care. We are the country's largest vision care provider as an ancillary benefit. We operate in all 50 states and most United States territories. But what a lot of people don't know is that today, right now, we cover 1 in 4 Americans. We are the largest insurer by membership in the United States, even though we're an ancillary carrier. As such, I'm going to comment on 2 things throughout our few minutes today. The first is obvious, and that is the health disparities that are disproportionately hitting minority populations even harder during these COVID times. It's not only sad, but it's also compelling to act, even for organizations such as VSP. I think that the second thing that I want to comment on, that I'll do a little bit of a deeper dive right now, and that is the economic and COVID factors we all know have led to record layoffs. Steve referenced it. On a national basis, VSP is likely most known for our large group business. We cover over half of Fortune 500 corporations, for example. But what people don't know is the majority of our business are small business and small employers. And that's a majority just from how many employers we cover. Well, because of the rampant loss of jobs and furloughing that's taking place, the last statistic I just pulled this morning is about 7.7 million people have lost their jobs as a result of the economic and COVID crises. And most experts agree that will push 10 million people by the end of this year, particularly with the recently announced layoffs in the aeronautical and airline industries. And most people aren't aware that particularly vision and dental plans, if you lose your benefits, you can still purchase them on an individual basis. And fortunately, we're not in the realm that Dan was referring to. Medical premiums, we know how they compare to just an ancillary, to where the average vision premiums are, $13 or $17 to $15, per month. But I don't know too many people that, especially in difficult economic times, who need a change in prescription or need a new pair of glasses or contacts throughout a given year, are going to be happy to spend $700 out of their own pocket to do that, when they can spend $250 in premium and get coverage for themselves and their families. And so we're fortunate that vision care is one of the lowest cost benefits. It's along the same lines as dental. And presently, VSP covers, of the 1 in 4 Americans, so I don't know, let's call it 78 million, 80 million people that we cover throughout the United States. 2 million of those come to us through the individual side of the house. And so that market is exploding and has incredible growth, largely due to what's happening as a result of COVID and what's happening in the industry. We do a lot of Medicaid business and medical assistance business, and that is also rising in disproportionate numbers. And so those are the two things that I wanted to focus on today.
All right, thank you, Al. We're closing in on the end of 2020, and I think a lot of people are going to be happy to see this year come to an end. But this is the time of the year that we also start looking ahead to 2021. And I'm going to ask our panelists here if they can gaze into their crystal ball and tell us what they see happening in their business in 2021. And Steve, I'm going to start with you.
Okay, so my crystal ball is highly suspect. You should see my football picks to start with that, but there's actually, it's just such a difficult time to forecast, but nonetheless, we are actively about the business of forecasting. Our business, we are a cost containment approach to healthcare. So employers would select our service and would come to us as an alternative to a more traditional plan, perhaps, and they would utilize us to save money. So in difficult economic times, we can become a go-to option. Companies that are in a situation where they need to conserve some money would look to us as a cost conservation measure. And so I think we're in a good position to capitalize on companies that are tightening the belt and looking at other options. We work through the brokerage community. We access our client base, our 550 independent businesses. We access them through brokers. In different times, non-COVID times, we used to fly brokers into our main office in Philadelphia, right outside of Philadelphia. We would put them up for a night and have a training session. We've had to go to an entirely different format now, which is remote. We are 100% remote at this point. In looking at the future, I think what we're realizing is it's highly efficient. I don't spend time in airports. I flew 150 some thousand miles last year. I've not been in a plane since February 28th. And I think I'm more productive, significantly more productive than I was before. I've been in 4 calls today. One I was mentioning, I was in Hattiesburg with some oil drillers in Hattiesburg, Mississippi. I was in Chicago virtually. And here we are on this call. So in the old days, 6 months ago, I would be sitting in airports and I felt, I'm an old dog, of course, I felt that you had to have the face-to-face, but we can't. And what we're finding is we're hugely efficient. And I think there's a real process in place where we try to harness that efficiency. I see with our broker trading partners, some of these brokers have plowed through this. They haven't missed a beat, and they've actually become stronger and more productive. Others have seemed to stumble with it. So I think the race goes to the swift, and those of us who can get faster at really utilizing technology, closing deals via Zoom, arranging reference checks via Zoom, doing all these things in an efficient, seamless way. For us, it also includes enrollment meetings, education of workforces. And, we have historically flown people around, and if a client had 20 locations, we'd send somebody to each location. We're doing that virtually now, and it really allows us to scale up in a different way. So I think that's one thing I see in the future. Another thing that what I mentioned on the first question was that we're seeing, how stressed our people are. We're moving closer. We're having more of these executive meetings where myself and our president and our one of the co-founders, we talk to groups of 10 and 12 employees at a time virtually. And frankly, I'm learning more about what stresses they're under, what the company can do for them. So we're really trying to focus in on that. And we realize like productivity often is related to being able to get good daycare. These things are not distinct, but I just didn't know it. Frankly, I'm embarrassed to say that, but I've heard things talking to people that I didn't understand before. So, I wish I could have learned these things without a pandemic, but sometimes you're just forced into changes. So we're seeing that, and I would love to see the future have more allow employers like ourselves and our client base to be more responsive to what's going on in people's homes, and to have a true maybe a different employer-employee relationship. I think that's possible. On the social questions, the racial questions, the inequities. There's been a lot of thinking. There's been a lot of talking. We are taking some concrete actions now, and partnering with some high schools in the city of Philadelphia, and we'll look elsewhere. To me, my personal opinion, I'm not speaking as the company now, I'm just speaking as myself. I have certain skills and abilities, and people in our company do too. And if we can share those skills and abilities with others, that's the best thing we can do as a business. I'm trying to leave some of the social arguments and especially in an election year, it's just everybody's so charged that sometimes we spend so much time arguing or jousting, so to speak, that we forget what we are capable of doing. And so we're trying to take more action and less rhetoric. And I think that we formed a committee, a diversity committee, to address these issues. We grew rapidly. We went from 30 employees to, with mergers, we're at over 600 now, and probably will be 900 soon. So it's a very rapid growth in trying to bring all these things together. And culturally, we're from Texas, Philly, and Salt Lake City. God bless America. We're different. We're very different. So I don't know. We're making the best of the situations. I see opportunity, and I think it requires technology. I think it requires getting closer to your employees. And I think it requires looking around your community and saying, what do we have that can be of value to others, to give opportunity to others? And we're actively engaged in all of that as we speak.
Okay, thank you, Steve. And I especially like those comments about learning things from the pandemic, and that there are opportunities out there that we can all take a look at. Al, I'm going to turn to you next. And can you give us a glimpse into the future from your point of view?
Sure. Thank you. I think Steve is on to some points that are similar to where I'm coming from and where VSP Vision Care is coming from. We rely a lot on brokers and commission salespeople to sell ancillaries, dental and vision and whatnot. And we noticed with COVID an absolute surge in brokers registering with VSP to sell vision care. And this is not just a normal surge, it's a deluge. And back to Quincy, that sort of kicked things off, being involved with an agency, what's happening is that commissions are squeezed, and people are realizing that ancillary benefits, particularly dental and vision, can be a very strong source of supplemental income for the brokers, agency community, and their related cohorts. So you get into GAs, MGAs, FMOs, and all the way down. And particularly when you're able to pay multiple levels, because you have a lot of producers that are sort of feeding into selling employee benefits, particularly during these pandemic times, that tends to really make a difference. And so I think that we're going to see a lot more of that in 2021. The other phenomenon is a rise in bundling sales, and I'll talk about that in a second, and also a rise in platform sales. And both of those are related. They're very large platforms that market myriad employee benefits. And the ones that we tend to favor are those, it's like an Amazon, or it's like a marketplace, to where you can buy, in our world, in the in the ancillary world, you're able to buy a dental, vision, and hearing plan in a single sitting in 7 minutes or less, right over the internet. All the PHI is protected. The utilities are built in order to protect Americans that are doing commerce in this way. It has the appropriate security controls and so forth. And the other phenomenon that I'd like to comment on in terms of 2021 is that we did a lot of analysis going back to the last recession. And the 2008 recession is nothing compared to what we're experiencing today. That's a given. But in analyzing 2008 compared to today, we saw a 6 to 9 month delay in dropping membership, which is really fascinating if you think about it. Particularly as an ancillary carrier, we'd like to think, gosh, we're the least expensive, so we'll be the last to be canceled. And I know that can work the opposite direction as well. And we've seen drops in our small business, we've seen drops in our large business so far. But based on that 2008 analysis, there's probably more membership drops that we're anticipating. Now, the flip side, and the reason why I was fortunate to be in front of you in this group today, is that in the individual market, we are exploding. We are having a fantastic year from a growth perspective. And so our membership is up substantially. And the exchange Medicaid business, which also makes sense, is also up in membership. And I say exchange, but I also mean platform sales, because VSP participates in a number of the most popular platforms in order to round out that total benefits purchasing experience. And so we're anticipating that we don't know where we are in that growth curve, and we're anticipating that there will absolutely be more of those same trends in 2021, particularly during the first part of the year until a vaccine starts to take hold and we really make some progress against this hideous disease and situation we find ourselves in.
Okay. Thank you, Al. Showing some optimism there in the middle of all this uncertainty. And now I'm going to turn to Dan. And can you tell us what you foresee happening in 2021?
Yeah, so I couldn't agree more with some of the things that Steve said about how we'll do business going forward. I think our days of traveling like mad people will subside to a degree, and I don't think that's a bad thing. But two things I want to talk about. First is something kind of leading more in that technology side and doing things more remotely. One of the things we saw happen is the leveraging of telehealth and virtual visits to see a provider. We were averaging about 80,000 a month prior to COVID. In April, we did 3.7 million visits. So that has really brought us to a point that we thought we would be at in maybe 5 to 10 years. It's really accelerated that to today. So beyond that, and what's connected to that, is our ability to reduce costs by allowing care to be done in home, and the technologies being available to do that, like telehealth and like virtual visits, which have been used widely across all of our platforms, whether it's our commercial members that are covered by their employers, whether it's our Medicaid members or our Medicare members. So we've seen equal increases across all. With the adoption of that, it gives us the ability to come into the home and do more care remotely by leveraging telehealth, but also by leveraging wearables. Wearables for people who have diabetics that will monitor their diabetes on a daily basis, reporting back to us and providers remotely. The same goes for people that are dealing with weight loss, to deal with their obesity, and a myriad of other types of in-home care that we can now provide to allow people to receive their care in the comfort of their own home, reduce the need for people having to travel, reduce the burden on the healthcare system in total, and allowing providers to come to the person in their home to receive their care. But one of the things we talked about that's really going to be on our mind and has been our mind going forward is dealing with the health equity and achieve greater diversity and inclusion in healthcare. One of the things we know is that a big driver of health are social determinants of health: lack of housing, lack of nutritious foods, and lack of basic necessities that really affect people's health care. So how can we fix that, and how can we help move that in the proper direction? So we've dedicated $400 million in new investments to advance and accelerate our work in this area, whether it's committing $100 million to affordable housing and building affordable housing throughout the country, whether it's committing dollars to food banks. And we've done that locally right here in Philadelphia, where I am. We've donated in the recent months over $2 million to local food banks. We cover food as part of our Medicaid plan. So our Medicaid members can actually get food delivered to them if a need is shown and it's related to their health issues, and we will cover that as part of their benefit. So how can we work on accelerating that, not only financially, but through benefits coverage and things of that sort, and not only do that, but do that within our own organization. So one of the things that we've said that, over the years in terms of diversity within our own organization is that if you look at our business, it's just not a diverse business. So there's not people out there that we can recruit. Well, we've stopped saying that. It's our job to become more diverse and bring a diverse voice to the organization, and we need to build that from the ground up. So we're working with the Inroads internship program, which helps recruit diverse individuals into our internship programs with the hopes of identifying individuals to bring up through the organization and grow through the organization. We're working to recruit the very diverse and what we know is a very talented workforce coming out of the military. So how can we recruit people coming out of the military that are diverse, bring them into the organization, and build that from the ground up? So we've really taken a step back to say, this doesn't exist. It's incumbent on us to build it and develop it for the future. And those are some of the ways that we're doing it.
Okay, Dan, sounds like there's some exciting things coming up at United Healthcare next year. We all know that COVID and the resulting recession has really hit the Black community especially hard. And I'm going to ask our panelists if they can give us some comments about healthcare and employee benefits as they relate to NAAIA members and to the Black community. And Al, we're going to start with you.
Thank you, Susan. I do have a lot of strong feelings on this, maybe for obvious reasons, but when you just look at the national statistics, it becomes quite scary. HHS says that African Americans are 60% more likely to get diabetes. That's just an astounding statistic. And 40% of African American men have hypertension or high blood pressure. You compare that, particularly that last statistic, to non-Hispanic whites, and that's at 28%. So you have a disparity of 28% roughly of whites compared to 40% in the African American community as it relates to one of the highest morbidities in the United States. And that's the reality. That's the reality that we have to deal with. And it's a known fact that diabetes causes vision loss. And so while VSP has always been part of the medical spectrum, and we have always contributed to providing medical diagnosis data to major medical carriers similar to Dan and United Healthcare, while that's always been part of our mission, we have almost a maniacal focus on making sure that all people get in to see their optometrists or ophthalmologists in order to get a comprehensive eye exam so that we can contribute to bending that curve. And when you raise those statistics even higher, 50% of all adults in the United States, according to the CDC, are impacted by diabetes. And I mean, that is just a massive number of people in the United States. And 1 in 10 adults today actually has the disease. That's some 34 million people in the United States. Yet 25% of them aren't even aware that they're diabetic and they're heading to a potential diabetic episode that could be life-threatening because it's undiagnosed. Diabetes is the 7th leading cause of death in the United States. And that's how serious we are treating it, at least as the VSP organization. Diabetes, hypertension, high blood pressure cause complications in the treatment of COVID. That is a medical fact. Obesity contributes to that, and so forth. And the percentages really take off in the case of prediabetes. And that's where organizations like VSP and ancillary providers that are in this space can contribute to trying to bend that curve as well. Of the 80 million people in the United States that the CDC believes have prediabetes today, 90% are completely unaware of that condition. And so what VSP does through every comprehensive eye exam that an optometrist or an ophthalmologist provides is they do a dilated retinal exam to inspect the back of the retina and determine if someone potentially is a candidate for diabetes, or if they could potentially have prediabetes or hypertension. Even high cholesterol can be seen through a dilated retinal exam in the back of the eye. And so as such, it's important that all carriers, not just medical carriers, continue to feed the system and get people in there at high risk. Namely, going back to the top statistics that I mentioned at the outset, with the high preponderance of African Americans being hit with diabetes as well as hypertension, and make absolutely certain that those appropriate referrals are made from the optometrist or the ophthalmologist, getting them into the medical system so that we can do our part, even as an ancillary carrier. And when you cover 1 in 4 Americans in the United States, we take that issue very, very seriously. And we've got a lot of documented positive results in terms of helping and doing our part to bend that curve.
Okay, thank you, Al. I had no idea that optometry was such an integral part of overall healthcare. So those were really great insights. Dan, I'm going to turn to you, and I was wondering if you could give us some comments about healthcare and employee benefits as they relate to NAAIA members in the Black community.
Yeah, so I talked a little bit about social determinants of health and how we're trying to improve those areas in order to improve the overall health of the community. But let me kind of give you a scenario of how maybe all these things come together and how they look. So diabetes is a great example. It disproportionately affects the African American community, and it is a huge driver of healthcare costs in this country. So how do we solve for that issue, or begin to solve for that issue? Well, the biggest driver of diabetes is obesity. And so how do you resolve the obesity problem? Well, once a person is an adult and obese, it's really hard to get you to change their behavior. Those in underserved communities are typically obese because they don't have access to healthy foods. So really, it needs to be addressed with childhood obesity. So how do we prevent childhood obesity? Well, first we go into those communities where minorities live that may be challenged by some of these social determinants. And we provide avenues through our health benefits, whether Medicaid, employer benefits, to get healthy food. We support in those communities the centers that provide food to those communities, both through financially donations and contributions, as well as covering the work that they do through our benefits. But then, okay, so now we've got a person at least eating healthy, but they're still overweight, whether it be a child or an adult. How do we leverage that in-home technology that I just talked about to make it more affordable for that individual to get healthy? So we currently have a program called Real Appeal that is a diabetes prevention program masked as a weight loss program. So we've learned, if you say to people, we've got this great program to prevent diabetes, they won't participate. But if you say we've got this great program that's going to help you lose weight, they tend to be more apt to participate. And it's all done virtually. It's a program that teaches people how to eat, how to manage their diet, and how to manage their diabetes if they have it, but more importantly, try to get them to avoid having diabetes if they're pre-diabetic. It provides one-on-one in-person coaching for an individual. And again, very expensive thing if you had to do in-person live, but if you can do it virtually, it really mitigates the cost to enable us to bring that type of one-on-one direct support to a person in their home through a myriad of virtual vehicles, phone, television, computer, a myriad of ways to provide that support. So leveraging kind of all the things that I've talked about, the ability to use the virtual landscape to bring care into the home, which makes it more affordable and accessible, leveraging our commitment to communities of diversity and trying to support them both financially and through the benefits that we provide to mitigate some of those social determinants of health in order to improve their overall health in the long run. So those are some of the things we're trying to focus on, that, and that's how we're kind of trying to make it a little bit more real.
Okay, thank you, Dan. And Steve, I'm going to turn to you. If you can give us some comments.
This is a great discussion. One of the goals I think that is worth looking at is, especially for members in minority communities or people who might be in lower margin, lower wage jobs, there's a tendency, as healthcare costs remain uncontained or continue to go up, that employers just push more costs down to the workforce. And while I might be if I'm talking about my $150,000 a year IT programmers, a benefit is a retention tool. Benefits are a retention tool for them. But for somebody making $14 an hour who gets another $1,000 dropped of out-of-pocket costs dropped onto them, it's a quality of life issue. And I think that in some cases, in many cases, linking employment to healthcare doesn't work. It simply doesn't work. It doesn't serve the people that are most vulnerable. And often folks have several jobs. They work here for a while, there for a while. They're in high turnover industries. So it's very hard. Some great ideas have been proposed here, but if they could, how does an employer invest in a plan when there's 70% or 80% turnover? How do they get any continuity of treatment or programming for the employees if there's a constant revolving door? So perhaps we could look at, uncoupling for many people, healthcare from employment. I think that's one thing we should look at. Some great examples have just been cited. And one that I found that was just interesting to me was Children's Hospital in Philadelphia here. They found some of the blocks in West Philadelphia have asthma rates that are off the charts. They're 4 times higher than they are where I am 10 miles away. And the kids would cycle in and out of the emergency room, and it just went on and on and on, and great care was provided, but they weren't getting anywhere. Well, guess what they found out when they went out and looked at the houses? That they were loaded with mold and environmental risk. So they created remediation companies that employ people, could be minority owned, and stops this just smart interventions. And that's just one example. How many of them are there like that, where smart healthcare tactics and therapies could be turned into employment, or just using our brains a little bit instead of just this endless cycle of treat, release? Can we make some impact here? So some of them, United is doing this on a grand scale. It sounds like Al's company is doing this as well. But are there opportunities for the brokerage community who live in the community and know the community and have access points to bring some of these ideas to fruition? I think that's where we can not only advance health, but we could develop some centers of economic development. A health plan generates a ton of jobs. It generates a ton of revenue. And are there ways to bring some ownership into the inner city, perhaps, with some of these ancillary services and some of these great remediation type things and some of these really exciting technologies? Can we make some economic gains there as well? So Healthcare is we're not selling widgets. We're selling, it's very much a quality of life issue. And if you're not getting good healthcare, or you're paying a disproportionate share via copays and deductibles, it's not just, it's not a jersey. It's not an optional item that you just purchase and can shop around for. It really makes a difference in your life. So this is encouraging to me to hear these things. I feel optimistic, and I'd be interested in continuing this discussion. How do we build some sustainable economic models around healthcare? And I think it's very doable.
Okay, Steve, you've given us a lot to think about, so thank you. We're closing in on our allotted time, but I wanted to give our panelists a chance to give us any final thoughts. And also, I was wondering, Margaret, if we had any questions and answers, questions that needed to be answered. So we'll start with the final thoughts. Do any of our panelists have anything they'd like to say that we didn't already touch upon?
No, I would just say that I really appreciate the opportunity to be here today. I would like to continue the conversation in any way that we can. So I'd love to hear thoughts and comments from folks in attendance or from the association itself. And I'm all ears as to how we might help or participate in any kind of projects going forward.
Okay. Al or Dan, anything you'd like to say?
Mine is very.
Go ahead, Al.
Sorry, Dan. I would just like to reiterate the message that I indicated previously, that eye doctors can play a early and crucial role in the early detection of some of these maladies and the health disparities that exist with African American populations, Hispanic populations, and other people of color in the prevention of eye disease and the prevention of blindness, which is one of the most significant and debilitating impacts of the diabetes epidemic today.
Okay, and Dan?
Yeah, again, just thank you everybody for having me, and agree with Steve that this is a discussion that needs to continue, and know that big organizations like United Healthcare, we're aware of these concerns, and we are doing all that we can in leveraging the resources that we have, not only from a financial perspective, but in terms of getting into communities and providing the support and help and filling some of the needs that are there in order to help those communities advance. But there's a lot of work to be done, and continuing to have robust discussions like this will hopefully escalate those needs and advance them.
Okay, we have a question here that I'd like to pose to the panel. And that question is, what specific actions are being taken to bring about a more diverse workforce within each company? Dan, let's start with you.
Yeah, I talked a little bit about it before. One of the things, like I said, we recognize in our industry is that our organization lacked diversity because our industry lacked diversity. And we typically recruit it for experience. We had to change that thinking. We had to take on the responsibility of developing diversity within our organization and our industry from the ground up, and couldn't use the excuse of, well, there just aren't experienced people that are diverse. And so forth. And it was before the most recent upheaval. We, for the last 5 years, have been leveraging organizations that support diversity and in bringing in people from the ground up, whether that's working with a inroads internship program, bringing diverse interns in to start to develop people from the ground up, working with the military recruitment firms to bring diversity from the military into the organization. So we're taking on the responsibility of developing a diverse workforce from the ground up, because it did not exist or doesn't exist in the mass that we need in our industry to really fulfill the need that we have to have a diverse workforce. So those are some of the actions we've been taking.
Okay, Al, what about your company? What actions are being taken there?
Thanks, Susan. There's a couple in particular. One is that we have elevated the level of the chief diversity officer within our organization that now reports up through the most senior executive in the organization. And so that's one step. The second is something that isn't new, that we've done for a long time, and that is we have established, similar to what Steve was talking about early on, we've established what we call business resource groups. And those business resource groups, there's an African American business resource group, there's an Asian and Pacific Islander business group, there's one for the LGBTQT community. And as such, those business resource groups exist not just for minority populations and people that fit into those particular business resource groups, but for anybody to join in order to advance the business related to those particular minorities. And so it's a really unique program. It's one that I've been involved with for many years. And we see that because there are so many business opportunities that exist as a result of what we get out of those business resource groups, and they're staffed by rank and file employees.
Okay, and Al, we also had somebody here who wants to know if you can share the statistics that you presented. So Margaret, are you going to be able to give him that contact information?
Absolutely. And
Okay.
the recording of this session, it will be made available as well. So they'll get it to you.
Very good.
Right.
And then finally, Steve, let's hear from you as to what steps your company's taking regarding diversity.
Yeah, so we're forming a partnership with a local high school that has an existing internship program. It's one of the Cristo Rey schools in Philadelphia. They have them all across the country. It's a very interesting process they go through. So that's one step. We've also retained a gentleman who's very connected. He's a graduate of an HBCU, and he's opening some doors for us for direct employment, not just internship. But we're working at the high school level, and then we're working with at the college level as well. We've also formed a diversity council inside our company. I mean, I'm a 66-year-old white guy, so we need people that are younger and a little more connected to the community. So we formed a council, and that's it's been interesting. It's been people have volunteered, and LBG, I get my acronyms mixed up, but a lot of our gay employees have stepped up. People from all walks of life have stepped up. It's really interesting to see it come together. They're reaching out to the community, and we've got some specific targets and goals. We're trying to treat it. There was a great article in the Wall Street Journal a while ago about somebody was giving advice, said treat it like a business. Have objectives, goals, milestones. Just go at it with that. I mean, there's a soft side, but then there's a business objective, key performance indicator kind of approach to it. Get it done, and we're working on it in that respect as well. So. We're just trying to grow some talent that can really come into our culture right out of school. Hopefully, that's worked well. Internships have worked extremely well for us as a company, but they have not been diverse. It's been people in the companies, kids, connections. It's just the way it happened for years. So we have to be a little more intentional about it. And that's what we're doing now.
Okay. I'd like to thank all of our panelists for giving us something to think about. Employee benefits. As an employee myself, I really depend on those benefits. And, as a writer who covers employee benefits, I see how it's such a crucial part of what brings workers to work every day. It's not just having your hospital bill covered if you get sick, but it's really your financial wellness, your peace of mind. It really is a big part of your life. And people like me depend on brokers to help educate them on their benefits and what they do for us. So, I want to thank everyone for what you do. And I guess we can take it to Quincy now.
All right. So again, Susan, Steve, Al, Dan, thank you guys so much. I say again for not only volunteering your information, but also just coming to the table and wanting to have what some may even perceive as a difficult conversation or uncomfortable conversation, especially you talk about race. But I think one of the common threads that I heard from each and every one of you, and I appreciate the sincerity of it, is the conversation must continue. And I just want to say this on behalf of NAAIA, myself being a past chair and knowing the passion and the commitment and the vision of NAAIA, is that respectfully, and I ask this question, that you allow NAAIA to hold you accountable to that ask. And there, we have conversations outside of this forum that can continue to advance those talks, but more importantly, turn those talks into action. I think NAAIA as an organization, both nationally and locally, has the diversity of talent and thought leaders, brokers and carrier reps and leaders of companies that can really give you some really good insight into what you're looking for. So again, with your respecting of that request, we will hold you guys to accountability to say, okay, we will have this continued conversation. So with that, I do want to say again, thank you guys for being panelists. Thank you, Susan, for moderating this. Thank you for all those that attended and taking some time out of your day to attend this session. We really do appreciate it, and hopefully it was valuable to you. And then last but not least, got to get that plug in there of some upcoming events. So just remember today's event that we had, but also coming up on the 27th, we have our National Talent Development Competition. I'm pretty sure you'll be seeing more of that communication coming out and via emails and blast. And also our career fair that's in conjunction with that talent convention, talent competition that is coming out. Then also on October 28th, our Junior Achievement Launch event. So stay tuned to your email, stay tuned to all of our social media posts that are going out, because we are communicating this to you. And again, thank you for attending, and I hope this was valuable. You guys stay safe and be well.
Thank you.
Thank you.
Thanks very much, folks.